So within those core functions, we monitor statistics, monitor signs, and keep track of those diagnosed. Investigate the reason why these things are happening. That's from heart disease to STDs and assisted suicide. Inform and educate. We're gonna educate healthcare professionals as well as patients. Mobilize the community in partnership and policies. This can occur with the setting our goals, educating the community, ensuring assessments are done correctly. Assurance is provided by ensuring that we have competent workplace environment and evaluating the statistics once change takes place. So, in regards to sexually transmitted disease, we're going to talk about statistics. Approximately from 8 to 10% of the population is growing. People age 60 and above in the last 6 decades has grown that much. The predictions are as different as 40 years. We're going to grow about 22% in those who are older than 50 years old, 60 years old. So the rise in elderly population is expected to go from 800 million to 2 billion people. Um, Now, keeping track of those diagnosed and finding out the reasons why these things happen. Assumptions regarding the elderly are based on outdated stereotypes in context of sexuality. Because of medical advances, our 80-year-olds, 50s, 60s, 70s, 80-year-olds are a lot healthier than they were, say, 40 years ago. A literature review of epidemiology of STIs in regards to elderly has shown that there's been increased rates within the population of people that are older than 50 years old in North America, Australia, China, Korea, and sub-Saharan Africa. So let's talk about investigating why. Individual vulnerability is related to the amount of quality of information that a person has regarding their problem and the possibilities of addressing it. Several factors are considered, including the level of knowledge of education, access to information. Subjective factors include values and beliefs. Biological factors, the exposure and susceptibility to risk. Social vulnerability is formed from the access to data, healthcare, education, culture, employment, as well as the practice of change when new information is received. These conditions are associated with access to material resources and social equipment. So, what do we need to do? A study that I read, it said that our healthcare professionals need to consider that the elderly are sexually active. They are able to acquire STIs, and we need to make sure that we educate them about prevention. So I guess when a lot of elderly people are being assessed, we're not really taking into consider that they are still being sexually active when we're skipping those questions or just assuming, when really we should really be asking those questions the same way we would be asking a younger population. Once that is into play, then we can move forward and start to measure whether numbers are getting better than they are now. In regards to the assisted suicide, the statistics show not the amount that it's being done, but who's in favor for it, and about 25% of elderly are in favor for it. A study was done, and the main reason why is because elderly are scared of death. They're scared of the unknown. They're scared of dying slowly, dying sick, and also it showed that those who are in favor of it usually don't trust their physicians, their nurses, their healthcare professionals. And so in order for us to, I guess, inform and educate those elderly people, we need to get out there and inform them that we're there to take care of them, hopefully get them to trust us, build that rapport, and that way they won't be so scared of maybe getting an illness and turning to the thoughts of suicide. And then we can measure then what's that, what are how their views change. In regards to all other health issues, the non-controversial ones such as stroke, heart disease, Alzheimer's. Those ones, we just need to get out there. I feel like we already have a lot of education on that, but continue to provide education to the elderly. Sometimes they're not really open to new information, but we can get them that information. We can teach them how to live healthy and all that good stuff.